Does Obamacare solve the funding problem for cancer patients?
Yeah, you're going to turn to me and ask me to answer that
All
question,
right.
and I cannot answer that question. What, in general, Obamacare does is to increase the number of people who are insured in this country. Most of them will be rolled into, we call it here in California, Medi-Cal, so Medicaid is the other term nationwide. The roles of Medicaid will expand. It will be a lower cost system and probably a lower reimbursement system as well. One of the real scandals I think we have in this country is that we have 40, 50 million people who are uninsured. And just as Eva was suggesting, even the middle class may end up being uninsured for a variety of reasons. Or a good example here in Orange County, some people carry such high deductibles. I've had patients with $20,000 deductibles in order to be able to have their Blue Cross or Blue Shield insurance. And then once it hits, we have to turn to an agency here in Orange County called CalOptima to try and cover that first 20,000 so that the other will kick in. So my hope is with Obamacare, and obviously there are lots of unknowns, is that it's going to start to smooth things out a little bit, increase access. I know that hospitals and physicians are worried about Obamacare because of decreasing reimbursement, but more to be revealed.
Okay,
That's so true. I know that I've talked to so many parents whose children have had leukemia or they have some sort of cancer. And almost every parent I talked to had a 30/70 medical insurance. So they were paying 30%, their insurance was only covering 70% of everything. And when you've got a child that's got leukemia and their first hospital stay is 4 months, can you imagine what the bill on that is? $500,000 to $600,000, and you're paying 30%. I don't care if you're upper middle class or you are rich like crazy. After 4 years of that, or 5 years of that, and then a recurrence and a recurrence and a recurrence, you're going to be broke.
Yep, no, you're absolutely right, Eva. And I've lectured and traveled around the world a fair amount, and we've got a real scandal in this country for those kinds of gaps and those kinds of things. But I think we're heading in the right direction with Obamacare.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.